Your poo and the poo of those you provide care and support for provides us an insight into many aspects of health and well-being. To enable you as carers to accurately describe and interpret a bowel movement, we use the Bristol Stool Chart. The Bristol Stool Chart describes seven different types of poo using pictures and words to enable you to talk about, describe, and record what poo looks like. By using the Bristol Stool Scale to get a good description of your poop, your doctor can estimate the time it takes for your food to pass through your body and leave as waste. The shape and form of your poop may also offer clues about some digestive problems. This will be discussed further on in the video. First, we will go through the individual types of poo and what they might be telling us about what is currently going on in the digestive system. The poo in the picture is small hard lumps that will be hard to pass. These are often likened to Maltesers or nuts and can be smooth or jagged. They are likely to be brown in colour, but you may notice some blood, particularly if they have been hard to pass. Passing these small hard lumps is referred to as severe constipation and indicates that the poo is taking a long time to travel through your digestive system. This can result from several things, which may include dehydration, a diet lacking in fibre, medication, for example pain medication, stress, or illness. Some people are more prone to constipation and are prescribed medication called a laxative to support them to manage this. It is important that laxatives are given as per the prescriber's instructions to be effective and that all administrations are recorded. Sometimes, if constipation is severe or prolonged, it can be referred to as impact, where very little poo is being passed, and this can be very dangerous and requires immediate medical attention. The poo in this picture is hard, lumpy and difficult to pass. This may be in a larger lump. These stools are still an indicator of constipation and can occur for the same reasons as the hard, small lumps previously discussed in type 1. Again, type 2 poos are likely to be brown in colour, but there may be the presence of some blood, particularly if you've needed to strain. Constipation can be managed by improving fibre intake, water intake and exercising to get things moving naturally. Considered a normal poo on the Bristol Stool Chart, this poo is likely to be brown in colour and smoother in consistency than type 2 poo. Although there is likely to be some cracks on the surface of a type 3 poo, it should be easy to pass. A type 3 poo indicates that the food travelling through your digestive system is doing so as would be expected. Type 4 poo tends to be a thinner poo. Smooth and more snake-like in appearance, it is likely to be brown and easy to pass. Again, type 4 poos are considered normal and considered to be an indication of your digestive system operating effectively. Type 5 poo is likely to be soft blobs, smaller than type 3 or type 4 poos and with clearer edges. This poo is the stage between a normal consistency stool and diarrhea and indicates that food is moving through your digestive system slightly too quickly, without the opportunity to take out the water and nutrients it needs. There are several reasons for this, but dietary causes tend to be the main culprit, with a lack of fibre to firm up your poo being one of those. Increasing fruit and vegetable intake will in most cases improve this. Type 6 poo will be fluffy, mushy, pieces of poo with ragged edges and is more commonly referred to as diarrhea. This is a sign that your food is making a rapid trip through your digestive tract. It is not absorbing what it needs and having time to form solid poos. The poo is likely to be brown in colour, although if caused by a virus, such as norovirus, may be more yellowy or green in colour and is likely to have a very strong smell. Other causes could include other health or digestive issues, medication, stress, or anxiety. Everyone will suffer from diarrhea from time to time, and it is likely that it will resolve once the illness or period of stress has ended. If type 6 poo becomes your normal, it is important to speak to your GP, as it may be a sign of more extensive or long-term health concern. Type 7 poo will be extremely watery with no solid pieces. This is the most severe form of diarrhea and, as with type 6, can be an indication of all the things described previously. In these cases, unless it is a sign of a more long-term health condition, it will resolve itself over a period, normally 3 or 4 days, but can be as short as 1 day and as long as 10 days. However, this type of stool is not always a sign of diarrhea and can be a sign of serious constipation, which is backed up or causing an obstruction. When this is the case, this type of stool is called overflow, and this happens when a large, hard stool, type 1 or 2, is stuck in the digestive tract, and the water that would normally be absorbed from the stool leaks around the hard stool and is passed. Obstruction is a medical emergency, and overflow should always be considered as a sign of this and medical advice is sought, particularly as there can be a crossover of symptoms with illnesses such as viruses. An example of this is that they can both cause vomiting. Some other things that are worth considering when looking after your or someone else's bowel health include the frequency of bowel movements. While there is no definitive normal in relation to how people poo, there will be a normal for you or the person you are looking after. If this normal changes, then this is something that you need to pay attention to. An example of this might be if a person goes to the toilet every day when they get up and this changes suddenly with no other symptoms. It might be indicative that the person is constipated. It is important that if you are caring for someone, you know what the norm is for them and communicate and record effectively any changes to this. Regular type. If a person's stools are normally a type 3 or 4, this is a sign of a healthy digestive tract and bowel. If this changes for any reason, consideration always needs to be given to the reason for this. Poo colour. As mentioned already, most poo will be brown in colour. There will be some variation of colour depending on medication, what you have eaten and what you have drunk, so on. However, there are some colours that you should always be aware of. Red. If you have not eaten anything that has the ability to dye your poo red, beetroot for example, then this can symbolise blood. Any new blood in poo should be referred to the GP for additional advice. Black. Some medications can make your stools black, iron tablets for instance. However, if someone is not taking a medication that this is a side effect for, it would indicate bleeding, particularly bleeding from higher up in the digestive system, and should be referred to the GP immediately. Green. Leafy green vegetables can make your poo greener than normal, but so can infection. So if your poo is green for a period of longer than a couple of days, then it's worth referring to the GP. Yellow. Yellow poo can also be an indicator of infection and is quite often seen with viruses such as norovirus. However, it can also be a sign of issues with the liver, gallbladder and pancreas, so should be referred to the GP if it's not something that can easily be identified as part of a virus or bug. Smell. Everyone's poo smells. It is the body excreting waste products which are going to produce a smell. However, if the poo smells more than normal or the smell is more potent than normal, then it might be a sign that something is wrong. If this is new or occurs for an extended period, it should be checked with a GP. Sink or swim. A healthy poo will generally sink to the bottom of the toilet bowl. If the poo is unhealthy, it is more likely to float. Recording and reporting. It is very important that bowel movements are recorded for anyone that takes medication for increasing bowel movements, anyone that takes medication for reducing bowel movements, anyone prone to constipation, loose bowels, malnutrition, or has a history of bowel obstruction or impacted stools. So just to recap, there are 7 different types of poo, and the type that we like to see is type 3 or 4. This indicates a healthy bowel and a healthy digestive system. Type 1 and type 2 poos can indicate constipation from mild to severe and should be treated with changes to diet, increased fluids, medications and medical advice in the initial instance. And if it is outside the normal pattern or lasts for more than a couple of days. Type 5 poo can indicate a lack of fibre. Initial management includes increasing fruit and vegetables to see if that makes a difference. However, if this is abnormal and continues with the dietary changes, medical advice should be sought. Type 6 or 7 poos normally indicate something wrong with the digestive system. This can range from a bug to a chronic condition to a blockage, which has already been discussed and is a medical emergency. Medical advice is always the first line of response, even when there are other symptoms. If poo is any other colour than brown, then it's always best to seek advice. If poo smells more than normal or changes smell significantly, seek advice. Spotting a bowel obstruction. Spotting a bowel obstruction is never easy, hence the reason that medical advice needs to be obtained as previously detailed. However, it is always worth being aware that it is not always your poo that tells us that there might be something wrong with our digestive system. There are other symptoms that might indicate there is a concern. Some of these symptoms include back pain, due to the mass of poo pressing on nerves in your lower back or sacral nerves, a swollen tummy or abdomen, high or low blood pressure, a fast heart rate, dizziness, sweating, a high temperature or fever, severe diarrhea that you have no control over, feeling or being sick, severe tummy pain. Dehydration, you may feel dizzy, lightheaded or tired, or have a dry mouth, lips and eyes, and pass small amounts of wee infrequently, less than 3 or 4 times a day. Swelling around the back passage or rectum. A numb feeling around the anus, bleeding around the anus, reduced appetite or feeling of fullness. It is important that whilst obtaining medical advice in relation to poo, we are also mindful and report any symptoms such as those above. This will help the GP identify if there is a possible obstruction, therefore a medical emergency.